Basically, mental health is being in a state of well-being across basically three aspects of your life. One is the physical. If you're not physically healthy, it can have a detrimental impact on your psyche. Two is your social health, being able to communicate, relate, converse with different people is a way in itself that shows you're fine, there is no problem with you. And then emotionally, being emotionally available and connecting with individuals, that itself is another key point that says, yes, this individual is mentally healthy.
And so on.
Sure.
Yeah, but this episode we're choosing to have a different trajectory.
Little spice.
Yeah.
To do different.
Yeah, add some spice into the mixture.
To the soup.
Season kidogo. Yeah.
Yeah.
But this is a very, very important topic.
Yeah, it is. Yeah,
it affects the majority of us, especially the healthcare workers. And it affects us in a negative way, in the fact that we know about this condition, but we tend to be, oh, it can never happen to me because I know about it.
Preach water and drink wine.
Yeah, but you know, use wine.
This is like a diluted blackcurrant.
Yeah, diluted yeah. So our episode today, we are talking about mastering the art of numbness among healthcare workers, and this is we're talking about how healthcare workers are usually affected by mental health issues, but they tend to ignore it, and it culminates to a point where some of them actually end up taking their lives.
No point of return. Yeah.
No point of return. Yeah. So as usual, my name is Ilyas Mohammed.
My name is Dr. Muhiddin. First episode coming in.
Yeah.
Tulikuwa na sisi pamoja kwa hizi vikombe ya uji. Mimi kama amejaa wenu hizi tumbler kwa the podcast. Yeah, it's good to be here.
Yeah, karibu. I'm very glad to have you here. It's been a journey. Long journey, but eventually we're on the couch pamoja.
Yeah.
Episode 3, Laughing Lab Code. Please like, share, subscribe. The other 2 episodes there, its reception was well.
Thank you for that, by the way.
Thank you. Really appreciate it.
Yeah.
So, do you know, episode 3, we're talking about mental health among healthcare workers.
Yeah.
And how healthcare practitioners usually neglect their mental health. And we are going to talk about factors that affect their mental health. Where does this start? What contributes to them individually and around them?
Yeah.
And how they can prevent this or go away about mental health issues.
True.
So,
yeah.
If you look at the beginning of the medical career, or the health career, it starts back in university. And in university, there are 2 selection criteria for you to be able to get doctors at the end of the journey.
And to get that paper, that degree.
Yes. So you have the academic selection, but you also have emotional selection.
True.
Emotional selection basically starts it's like a cult again.
Yeah.
In the first year, they show you dead bodies. You get to dissect the dead bodies, learn anatomy through them.
Yeah, people, whenever we came back home, people will be like, "Mnataka kucheza na maiti." Yeah. It happens.
It happens. So there are people who drop out then.
Yeah.
So that's one of the emotional selections. Later down the line, it progresses.
True. I think this is like a disclaimer for the guys who want to join medical school.
Mm-hmm.
There are some things that will test your emotional capability to handle real life situations, to handle social situations. So in your medical school journey, you will be put through some kind of, not like the paper tests, but a mental capacity to hold or to persevere through certain things.
Because the medical field is usually a high stress field. Filled with a lot of trauma, exposure to trauma. So once you reach third year, is when you're now introduced into seeing blood.
And it happens early sometimes, but majority of universities, I think, by third year, you're supposed to be doing it.
Yeah, and then that's another point of emotional selection. Some people do drop out because of they're not able to withstand. Yes.
Yeah.
Do you feel dizzy or feel like puking?
My first day, and tukiwa tuna watch to CS. Never touched.
Okay.
Just observation. Naona theater feels amazing, bro.
Yeah.
The tiles clean.
Yeah.
Lighting is set up vizuri. Unasikia tu ile machine ya anesthesia iko hapo. Inalia. So in the beginning you feel like this is the thing in the movies I'm here for. But when reality comes, you see the patient is brought. This is a real life human being. It's no longer those dead bodies you used to play with and learn on. And you notice it's not that game anymore. It's not that fantasy or that movie anymore. This is the real deal. And for me, I never really liked obs, like Pakasahi. Like it has never been my cup of tea. Okay, but yeah, I had to like force myself to do it. And from seeing the first blade pierce through, to seeing blood splash out, to seeing the amniotic fluid. Amniotic fluid did faint. I fainted once.
Yeah.
But the second time nikashukwa mkono nikamwambia bro kuja. Hii softy wacha. I was there assisting. So you learn by being sensitized. That usually comes. So for the guys who want, that one will come.
So now, if you give us just a very short definition of mental health, how would you define mental health?
Basically, mental health is being in a state of well-being across basically 3 aspects of your life. One is the physical. If you're not physically healthy, it can have a detrimental impact on your psyche. 2 is your social health, being able to communicate, relate, converse with different people is a way in itself that shows you're fine, there is no problem with you. And then emotionally, being emotionally available and connecting with individuals, that itself is another key point that says, yes, this individual is mentally healthy. Yeah.
Looking at factors that contribute to the detrimental mental health among healthcare workers, and you've talked about being emotionally fine, and we just talked about how med school makes you emotionally numb.
Yeah.
So once you're in a hospital setting and you are having periods where you have to separate emotions from your work, and you become desensitized, you become numb. Yeah. And therefore the title of our episode 3 today, Mastering Numbness. Yes, Mastering Numbness. So other factors that can contribute to poor mental health among healthcare workers, the most common one is burnout and being in a high stress environment all the time.
Yeah, I think it doesn't really start when you get your license. It starts early from being overworked with paperwork, presentations and assignments, cards, exams, and then you being forced to have it's not being forced, but you need to for you to get your paper. You sign out on your logbooks, attend cases in theater, watch and learn. That itself is like a slow but steady accumulation of the duties. Yes, it's a necessity, and depending on what you see and how you process it, it ends up affecting a lot of individuals out here.
Okay. Again, always being in a high-stress environment where all the time you're constantly worried about how the patient's situation is going to change. Because some patients are usually, status can change minute to minute.
Yeah.
Minute to minute. Again, one other downside of being in the healthcare is almost all the time you're exposed to death and loss of life. So eventually you become numb to even death. True, isn't it?
Yeah. That's why I think most doctors are not really okay, or healthcare professionals are not really okay. And the number of people who actually come out are minute. I don't know if it's because it's seen as a sign of weakness. I do not know. But I highly suspect. But there's a lot that needs to be done in order to prevent loss of individuals who are supposed to be given quality healthcare.
Again, one other factor is the working conditions and working environment. By this, we mean the resources that are available to you. We mean the peers that are around you. Your work environment is also the people who you work with. Your colleagues, your seniors, and your juniors. We have heard of instances where seniors are very insulting and
it becomes personal.
Yeah, it becomes personal to them, and they insult up your whole bloodline. Yeah, insults are laid upon your dead grandfather.
Yeah. Again, I think if we I don't think it's easier to come up with a way that will prevent that, because I think the previous generation of doctors who are now retiring, walipata dozi yao. The guys who are currently practicing and teaching are dishing out the dose.
But I know majority of the new consultants are actually very, very nice.
Professional, like hakuna.
Yes. Yeah, majority of the new consultants are actually very nice. Thankfully, I've not had any episodes of such.
Yeah, me neither.
So we're talking again about doctors who work in resource-limited areas. You actually question like yourself, like, why am I even here if you do not have the basic things to help the patient? And because you do not have these things to help the patient situation deteriorates.
You literally go against the oath that you swore, do no harm, and sometimes it works, sometimes it doesn't, and I think this is where the system fails us. You've decided to come up with a system where you have level 4s, level 3s, easy dispensaries, and nothing is really being done to the members of the public or the community. And when it comes to critical situations which need urgent attention or emergency attention, to be specific, that just cuts across depending on fulus mostly.
Yeah. What of doctors or healthcare workers who are unable to maintain a proper work-life balance? You see, conventionally, they're usually working hours in a day.
Yeah.
But you find people in the healthcare going past their working hours, and mentally they're occupied by what happened during the day, and they carry over what happened in the hospital to home, eventually affecting their individual relationships.
Sure.
Isn't it?
Yeah.
And he or she does not have time to unwind from whatever has happened.
Yeah. Well, sometimes it feels like you're unavailable emotionally, either because you're choosing to internalize what you went through, or and you choose to vent, and this person is like, me story yako nimechoka. You get so different people, different ways of putting it out, but I think most doctors are guys who internalize things. Me individually, I find myself doing that.
You are bad with communication.
I feel like
I'm very poor at communication.
Inakuanga mi niko na shida zangu, why should I come bother you with mine again? That usually is the ideology or the thinking most times.
So our support systems, does it mean that our support systems are lacking?
Very much. Never come a support group that's for healthcare professionals. I know the existence of a few hotlines or suicidal lines, yes, but we don't have that capability of giving attention to the guys who are actually taking care of the people. And not just the bad working conditions that can lead to this, not the burnouts. Even simple things as, give me my pay, bwana.
Pay.
Give me my pay.
Like what Ministry of Health is doing to us right now.
Yeah. Like, I sweated for this. It's not like nilikuomba, it's jasho yangu.
Yeah.
Like, I went through 6 years of doing this just to get myself to this point. And it's not that it was guesswork. It's something that it's earned, you get.
Within the medical field, it's a field that requires a lot of sacrifices. Whereby you find healthcare workers sacrificing their co-curricular activities and time with their families so that they can be able to complete a certain task or spend more time with the patient or put more time in the theatre. So this again is a contributing factor to detrimental mental health among healthcare workers. And before before healthcare workers recognize that they have a mental health issue, it usually takes them some time to accept. Yeah. It's like how, say, if you see someone who smokes, never think smoking is going to affect them.
Yeah, it's it's like an outlet for them.
Mm-hmm. So, and then this leads to drug use within among healthcare workers, and there is ease of accessibility to these drugs among us.
Yeah,
isn't it?
I think the biggest advantage, in a way that I think is not yet here but is coming soon, is the concept of hard drugs.
Okay.
Concept of hard drugs is there, but it's not entirely expounded on. So guys are on the minor things. Yes, those have their own detrimental effects, but it's a stepping stone. So it's like a ladder you're climbing. You move from this to this to this to this. Inafika a point where you find a healthcare professional just scrambling for certain medications just to
push them through the day.
Yeah, get them through the day.
Yeah.
And when it gets to that level, of which most times you find yourself going through there, through up to there, and you need to figure out a way of quitting in between, taking a break even.
Know when to take a break.
Yeah, just know when to take
know
a
when
break.
to push your limits.
Yeah.
Yeah. So the end goal, whereby the worst effect of this mental health is you have family separation, you have being relieved of work duties, and someone can go to the extent of actually taking their own life.
Yeah.
Let's talk about suicide among healthcare workers and just generally the whole Kenyan population.
Yeah, I think suicide is like an end result of a lot of things. Most common things being certain conditions like depression and substance-induced psychosis like kuchizi kusabia drugs, and also certain anxiety disorders themselves. They can lead to this. And I think one thing we forgot to mention is the degree of insomnia that medical doctors or healthcare professionals go through for a long term. In that 1, 2, 3, 4, 5 years, you've messed up your entire sleep schedule. You've messed up with the hormones that you need your body to replenish your energy sources, your brain tissue, your muscles, basically everything. It gets to a point where now the neural function is now switched to a point where depression kicks in, suicidal ideations come. After ideations, you now start thinking attempts. You now plan on ways. And it's a tough subject to talk about. Looking at the numbers, generally, suicide is the idea usually falls in among 4 people. One of them will always develop that idea. Has
contemplated it.
Yeah, he's thought about it. And general public, you look, it says 1.9 million in a study done by Kenya Mental Health Policy from 2015, stipulated to 2030. That's what they say. And funny thing is, healthcare professionals we know maybe they might be among that number, but we do not have a defined value to actually say you guys are having a slow incidence, or like there's a growth in the number of people who are developing these ideas, who are attempting to take their lives. We know 1 or 2 or 3 or 4 or 5 cases that have hit the news and stuff, but there's a lot that happens that does not hit the news that we don't see.
So when we try to prevent and create awareness for mental health among healthcare workers in our country and the world generally, there are some few preventive measures that can be implemented. Example of the ways where we can let out our mental frustrations is by talking to our peers and having support groups. I mentioned to you something called shared struggle. This is whereby people who go through the same kind of problems and hardships eventually form a bond. It would be very easy for me to make friends out of a doctor than make friends with someone who is not a doctor, because I sometimes, from all the sacrifices you make in the healthcare field, all the time you spend around as people who speak your language.
You're basically connected in a way.
So eventually, like you just said before, like even your risk game, or like how you even your risk goes down. Because all you speak is anatomy and surgery.
You cannot hit on a person who is not on the same level, any plane of thinking, or does not know what you go through.
This brings the question. We will discuss this on another episode of the dating life, home and hospital among healthcare workers.
Yeah.
Would you marry someone who is in the healthcare field or not?
Wallahi sijaulizwa hiyo swali. But I don't think I would.
Okay.
I don't think I would.
We will talk about it more in the next episode. Yeah. But yeah, speaking about dating, even spouses and all are part of the support group.
Yeah.
Because some spouses to healthcare workers do not understand what you're going through. They are not in that field. So sometimes they might fail to understand, or because of the number of times they've tried to reach you, or the number of times you've put in late night shifts. They're also humans.
Yeah.
They sometimes can have other thoughts. They sometimes feel neglected by you, and that you are dedicated to your work. And if you look at the healthcare person's point of view, it's like, I'm doing this to save a life.
True.
But you're also losing somewhere.
True.
These are the sacrifices, the hidden sacrifices they make.
I think majority of doctors, male and female, nurses are a bit... No. Okay, I don't know.
Yeah.
I cannot generalize.
Yeah.
I cannot individualize, but majority usually go into midlife crisis. You clock 30s, 40s, 50s. That's when you figure it out and say, I've been doing the party life just to calm my nerves after work. And like the society, basic African society, you've not really achieved anything if you do not have a family to go back to, or kids who pick up your name and take after you. You get? So most doctors most nurses on NKF line, which sucks. And it all stems to this.
Yeah. Part of the support group of ways where healthcare workers can cope with such issues are religious institutions or communities. True. Especially if we look at us as Muslims, depression is there.
True.
You remember, even for us as Muslims, there was a time the Prophet's child had died.
Yeah.
Prophet's children had died. His wife died.
Yeah.
And the surah was brought down for him.
Just to calm.
Yeah, just to calm him down. So even in Islam, depression is there. Our Prophet ﷺ went through it. But there is always ways to cope with it.
I think we need to do like a specific an episode purely on correlationship between religion and mental health.
Okay.
That those two, they go hand in hand.
Yeah. Okay. Aside from that, there are also physical activities or other activities where doctors can engage in. But more importantly, the doctors should know how to separate. They should have days off to themselves. To not be a workhorse looking for money. Although the pay is bad for... A friend of mine, Dr. Abdulaziz, was asking me how he can create a work-life balance where he does not prioritize working more and eventually losing out on physical fitness.
Yeah.
So it's like you have to gain one, lose one. But you have to look at what you're gaining and what you're losing. If you're gaining money but losing your mental health, doesn't mean anything. Doesn't count for anything.
It doesn't even come across to just mental health sometimes.
Yeah.
You notice look at most doctors, obesity kicks in.
Yeah.
They are sick. Some of them end up developing renal issues, kidney issues, because they dished their life to work. Yes.
Yeah. Occupational hazards.
The main thing that makes you feel accomplished is the job thing. Yes, but a break once in a while won't hurt.
Yes, know when to take a break. Engage in activities, community activities. Engage in physical activities. Separate. I'd even advise doctors or healthcare workers to go as far as having 2 days or 1 day where they absolutely switch off their phone, disconnect from the world, take time to themselves.
That's a really good idea.
Yeah. We actually need it. Because you recover and you recuperate.
That 1 day is enough.
That 1 day. Like how Now, Ministry of Health does not want to pay us for the 1 month paid leave. Ministry of Health anakuanga tu na ufala lakini. Wamekata kutulipa our last month of the contract. Na hiyo 1 month paid leave wanaturuka.
Maandamano.
And hakutakuwa na maandamano, but we're going to try and push it, and then if it fails, that's the only language you can speak in Kenya. Riot, yeah. So we have looked at just a couple of how to cope with and preventive measures against mental health issues. But are there any support groups for doctors? Are there any hotlines healthcare workers can reach out to, or the general public?
I think I know of several hotlines, suicidal hotlines. If you Google them, you can get them. But
I'm gonna put them in the description.
But specifically for doctors, sijawaiona, or nurses or any healthcare professionals, I've never seen. I've never seen support. I've seen support groups for like guys with mental health. They do mental health illnesses, psychiatric conditions, schizophrenia. They do exist, but the awareness for them is minimal. And then funny thing is, in our culture, you notice, yes, Quran is there. It's a cure. True, we agree. But some of these things are genetically inherited. Schizophrenia has a genetic component to it. Bipolar has a genetic component to it. And one cannot go without the other. So you kind of need both of them to be instituted together in order to give this person relief, not just approach from one way. If you have like a two-way approach, you're trying to tackle the problem in a proactive manner.
So in a nutshell, that was healthcare workers and mental health. Mental health among us. People who you find at the hospitals, people in white coats or so on, people in scrubs. Sometimes some of us are walking zombies where we are mentally dead, we are emotionally numb.
I was like that for like 2-3 months.
Yes, on the next episode, Home and Hospital, we're going to be talking about the love life of healthcare workers. How are they finding it?
How the risk game dies.
How you unasahau how to seduce women and talk to women, because all you do is read physiology and anatomy.
You'll be like your best ship like this.
I think we need medical pickup lines. Medical pickup lines. Do you know any medical pickup line?
Bro, yes, died.
Let me tell you one. You're so hot, you denature my proteins.
Yeah, that needs a doctor or a nurse to understand that, though.
Yeah, those are medical pickup lines.
That was smooth.
Unfortunately, ni watu wa BChem na
ndio wanashika.
Yeah. Unless kama hajafanya medicine. But yeah, thank you for tuning in to Laughing Lab Coat. Again, my name is Elias Mohammed.
My name is Muhyiddin Mohammed.
Yeah, this is Laughing Lab Coat, episode 3.
Do this thing. Enda pale chini. You see that button? Yes.
Yeah.
That red thing imeandikwa subscribe.
Yeah.
Iyo, cheza nayo.
Notification.
And then there's another bell thing inakaiko hapo.
Yeah.
Chezeni nayo. And then the last one ni share and then
follow our
and
social media channel. Yeah. Any questions you have, any medical conditions you'd want us to talk about, but mostly we'll be doing, next episode is Home and Hospital, the love life of healthcare workers. Yeah. Any question, anything to add?
I think we're good.
Good. It's been
we're waiting for you guys, your questions.
Questions and comments.
Yeah.
It's been a nice session with you.
Was it, bro?
Boom.